Hello and welcome to the training course on Climate Information Services for Health System Strengthening. Thank you for committing your time to learning more on this critical topic. The course is presented by USAID's Climate Adaptation Support Activity, CASA, in cooperation with the Bureau for Global Health and the Bureau for Resilience, Environment, and Food Security. This learning material was developed alongside a technical report and case studies to enhance USAID's ability to strengthen health systems resilience using Climate Information Services, CIS. These resources are linked at the end of the learning material. Welcome to your learning journey. In these learning materials, we'll explore how to integrate Climate Information Services, referred to in this training as CIS, into health system strengthening or HSS efforts. You'll learn about climate-related impacts on health and health systems, exploring the complex relationship between climate and health and how it directly and indirectly impacts health systems, the role of CIS in HSS, discover how CIS can be harnessed to reduce climate-related health risks and enhance health systems, how CIS can be used for HSS, getting an overview of how to leverage various types of CIS for effective decision-making. Lessons learned from the integration of CIS to support HSS. Delve into real-world examples, common challenges, and best practices for successful CIS integration. And you'll walk through a practical guide for USAID staff integrating CIS for HSS, getting specific guidance on assessing CIS opportunities, fostering collaborations, and developing context-specific action plans tailored to your work. For your reference throughout these materials, you will see the following abbreviations: CI, Climate Information; CIS, Climate Information Services; HSS, Health Systems Strengthening. Throughout the learning journey, you can see your progress in the navigation bar on the bottom left. Ready to begin? Let's dive into Module 1. Module 1. Understanding Climate-Related Impacts on Health and Health Systems. The learning objective in this module is for you to build a foundational understanding of how climate variability and change affect both health outcomes and health systems. The climate plays a complex role in shaping health outcomes and health system challenges, while extreme climate and weather events can have direct, acute impacts on health. Climate variability and change also influence health through indirect pathways and cascading risks. For example, heavy rainfall can lead to both direct infrastructure damage that disrupts health facilities and services and indirect impacts on climate-sensitive and sanitation-related disease transmissions. Low and lower middle-income countries bear disproportionate burdens of climate-sensitive health risks and experience higher vulnerabilities overall. Climate impacts not only the immediate health of populations, but also compromises the long-term ability of health systems to provide care. We see this in the changing patterns of vector-borne diseases like malaria, waterborne illnesses, food insecurity linked to drought, and the dangers of extreme heat. Health systems are often on the front line of defense against climate-related health threats, but are themselves increasingly overwhelmed. Climate and extreme weather events create surges in healthcare demand while simultaneously disrupting services, especially for the most vulnerable. Climate disasters damage facilities, strain supply chains, and worsen existing pressures. This leads to higher costs and less access to crucial primary health care. Recognizing the urgent need for climate-resilient health systems, we can empower communities to adapt and thrive by prioritizing investments in this area. This WHO graphic provides a helpful overview of vulnerability factors and climate-sensitive risks to health and health systems. Understanding vulnerability is a key starting point. Not everyone is equally at risk of climate change and variability. How vulnerable you are depends on several factors. Vulnerability in this context means how likely a system or individual is to suffer negative effects from climate change and climate variability. Demographic, geographic, and socioeconomic factors, for instance, all play a role. There are three core parts of vulnerability: Sensitivity. This relates to the degree to which someone or something might be affected by climate conditions, for instance, the onset of extreme temperatures. Exposure. This is how much someone or something directly experiences a climate threat. A helpful way to think about the distinction between exposure and sensitivity is this. All people that live in a town may be equally exposed to a stressor, such as a heat wave, but the elderly, pregnant women, and babies, and other vulnerable populations are more sensitive. Adaptive capacity. Finally, we consider the ability to adjust, manage increased risks, and/or maybe even benefit from changing conditions. Health professionals may think of this as their ability to understand, plan for, and manage climate-sensitive health risks under both normal and emergency situations. A clinic, for instance, trained in extreme heat protocols with the right information and resourcing is better equipped to handle patients presenting with heat-related illnesses. Vulnerability and vulnerability assessments in particular are therefore critical to a foundational understanding of climate impacts on health outcomes and systems. Climate change and variability can significantly influence the health of individuals and populations. We can best understand this by breaking down the pathways of influence into two categories: direct impacts and indirect impacts. Climate conditions can directly affect a person's health. Extreme heat is a clear example. Our bodies struggle to cope when temperatures rise too high, potentially leading to adverse maternal and child health outcomes, malnutrition, heat stroke, occupational injuries, dehydration, and other heat-related illnesses. Or climate conditions can indirectly affect human health. Imagine extreme rainfall damaging water and sanitation facilities, releasing sewage into a community. This increases the exposure to waterborne illnesses like cholera. Climate change can also indirectly impact through social and economic disruptions. Drought, for example, may devastate a community's agricultural income and sector. Health may suffer directly, malnutrition, and indirectly as a consequence of climate-driven hardship. It's important to understand that climate change and variability can affect health through increasingly complex and entangled pathways beyond these examples. This WHO graphic provides an overview of priority climate-sensitive health risks to consider. Another useful figure from the USAID climate strategy helps to disentangle the complex pathways through which climate change affects our health and can disrupt access to health services. To give an example, diseases passed from animals to human, known as zoonoses, are on the rise as the world continues to see climate and environment-related stressors. With 2.5 billion infection incidents and 2.7 million fatalities each year, zoonoses account for 60% of known infectious diseases and up to 75% of emerging infectious diseases. The list of zoonotic diseases is exhaustive and ever-evolving and includes the recent COVID-19 pandemic. Worryingly, science suggests that degraded habitats and increased climate threats may encourage more diversification of zoonotic diseases as pathogens spread easily from nature to livestock and humans. And we know that zoonotic disease outbreaks expose the vulnerability of health systems that are already overburdened in constrained resource settings battling heightened climate risks. Climate Information Services, or CIS, are essential for USAID to strengthen health planning. Taking climate factors into account help us to better describe complex relationships between climate and health variables, better anticipate and predict climate and health scenarios, and allow us to recommend interventions, recognize trade-offs, and optimize resources overall. CIS provide an opportunity to transform climate data and information into actionable resources for health-related programming and decision-making. The USAID Climate Strategy 2022 through 2030 and USAID's Vision for Health System Strengthening 2030 recognize the need to bolster the climate resilience of health systems using an integrated systems approach. Put simply, CIS can serve as a critical tool in achieving this goal, contributing to transformative systems change in 3 core areas. Improving equity. Climate change doesn't affect everyone equally. Involving local communities in CIS helps us address cultural factors, prioritize the needs of underserved groups, and recognize how gender plays a role in climate impacts. Focusing on equity means reducing the disproportionate burdens faced by the most vulnerable and making healthcare accessible for all. Optimizing resources. CIS improves decision-making, making our use of health system resources more efficient and effective. For example, it allows us to better plan for climate-related shocks and prioritize the interventions that will make the biggest difference. Maintaining, safeguarding, and improving healthcare quality, CIS helps us anticipate threats and manage risks, such as by adopting early warning systems that ensure proactive measures and essential supplies are available during crises. It also highlights the infrastructure requirements necessary to make sure healthcare services are resilient and as effective as possible in the face of climate impacts. Climate impacts on health are increasing in intensity, frequency, spatial distribution, and duration owed to climate change. All climate impacts are not, however, driven by climate change. Understanding the distinctions of impacts driven by climate variability and climate change is critical to design interventions and HSS overall. As this figure by NOAA shows, we have a higher degree of confidence that extreme heat and extreme cold is being driven by global warming and human-induced climate change, whereas we have less confidence that any given storm or extreme weather event is driven by climate change per se. The field of attribution, which investigates these links, is a rapidly growing area of research. Climate drivers, whether linked to seasonal or decadal variations or climate events like El Niño, need to be understood alongside the impacts of long-term climate change. When developing health interventions, it's vital to consider both climate change and climate variability to support resilient health systems. Our understanding of climate-related impacts on health and health systems has advanced tremendously, with a 6-fold increase in research on climate and health during the past 15 years. We know more than we've ever known about climate impacts on health and health systems, but there are regional disparities in what we know, and in the evidence being generated as shown by this Lancet-published map of the global distribution of climate health studies. The dearth of robust information on climate health impacts in the most climate-vulnerable countries and regions is clear, suggesting a significant need to invest in better and more data as well as targeted capacity-strengthening efforts in countries facing the greatest risks. This image is based on a machine learning review of 16,000 climate and health research papers published between 2013 and 2019. There is still much to learn to inform integrated climate and health services, grounded in better understanding of what the available data and research is telling us. In the Lancet review, one of the most comprehensive reports summarizing the state of knowledge on climate and health, clear regional priorities are identified related to climate impacts on health. These regional distinctions showcase the breadth of hazards, health risks, and impacts in climate and health research globally. The complexity of understanding climate impacts is significant and not to be underestimated. In future modules, we will learn in order to be effective, CIS must be fit for purpose and relevant for the needs of a variety of decision makers. In this way, CIS can act as a bridge, transforming the latest research and CI into actionable resources for sectoral decision-making, including health-related programming.